Women and men choose plastic surgery for many reasons, and often more than one procedure is desired.
Our next guests are here to talk about body contouring. Welcome Dr. Gregory Mantooth and Dr. Miguel Yanez with Piedmont Plastic Surgery and Dermatology. Doctors, good morning to both of you. Thank you so much for being here.
Good morning.
Good morning. Thank you.
First off, define body contouring. What is meant by that?
Well, body contouring is really using plastic surgery to shape the body. We always tell patients these are not weight loss operations. These are really operations designed for people who are reasonably close to their ideal body weight, but just who have stubborn areas or fat or excess skin that diet and exercise just don't respond to, or don't respond to diet and exercise. That's really where body contouring can come in to help.
I know you say you're generally looking at people who are close to their ideal body weight, but who ultimately would be your good candidates for body contouring?
I think the best candidates for body contouring are those that have good skin tonicity or good elasticity of the skin, that are close to their ideal body weight, and that have persistent areas of trouble that they don't seem to get better with exercise.
Okay. We hear about liposuction a lot. We hear the term tummy tuck a lot. Is that the same thing? What's the difference between a tummy tuck and liposuction?
Well, liposuction is really removing fat from various parts of the body, whereas a tummy tuck or abdominoplasty is really just focused on the lower abdominal area. A little bit more extensive operation, a little bit more of a recovery, but more focused to that particular part of the body.
And that helps women who've had babies and you get that mommy pooch that you just can't quite get rid of?
Precisely.
Yes.
Okay.
Or if God gave you just a hanging stomach, right?
Right.
Yeah.
Now, how exactly is the liposuction performed, Dr. Yanez?
Liposuction can be performed with a series of devices. Some of them generate heat via ultrasound or laser, and others just generate motion to break up the fat. But basically what it does at the end is it suctions the fat out from the area that you want to get rid of. And we use cannulas for that purpose, cannulas of different sizes with different port size or different opening sizes.
Okay, Dr. Mantooth, what about the tummy tuck? How is that performed?
Well, again, you know, with liposuction, you're treating fat on various parts of the body, but with a tummy tuck, it's the lower abdomen. And just as you described, it's really designed to treat just that lower excess skin and fat that may be a result of pregnancy or just from just having excess weight that's focal to that area. For women who've had pregnancy, it can remove a lot of the stretch marks as well, but it's removing that roll of excess skin and fat, and then we also tighten the muscle underneath to provide a nicer contour to the entire abdomen.
I'm wondering, how long can a patient expect these results to last?
The results will last as long as the patient maintains their current weight. So if they stay fit, if they exercise, if they eat well, the result that they obtain is pretty much the result that they keep.
Talk about recovery time from these procedures.
Typically, liposuction recovery is going to be a little shorter, maybe 4 to 5 days before a patient's back at work, whereas with an abdominoplasty or a tummy tuck, the recovery is a bit more extensive, and that can be, we typically advise about 2 weeks off.
Okay.
Okay. And then when you are released, let's say to go back to work, can you do everything you did before?
Pretty much so. With an abdominoplasty, because we have done work on the abdominal wall, tightening of the tissues, you have to wait 4 to 6 weeks before you start lifting heavy objects or bearing great amounts of weight. With a liposuction, less so. You just experience some discomfort in the area that was treated.
I know might sound gross, but it's actually really cool. The fat that's removed, you can do stuff with the fat that's removed, correct? Talk about that.
Yeah, we can transfer the fat. We can transfer the fat to areas where we need the fat. Nasolabial folds, the buttocks are a great area. Even the breasts can be treated with the fat. It's transplanting the fat.
Right.
So it's your own fat, and you use it to,
Yes.
like you said, you could fix this or...
Right. Yeah.
I think it's fascinating. It's so fascinating. You can submit your paperwork online even before your appointment. It saves you time once you're in the office. Just submit that paperwork online before an appointment. Visit Piedmont Plastic Surgery and Dermatology online at ppsd.com, ppsd.com, or call 704-542-2220. 542-2220 is the number to call. Thank you so much. It's always nice to see you.
Good seeing you. Thank you very much.
Appreciate it. All right.